going to something where people are telling you, hey, look, if you want to do this, you're probably not going to make any money for the first, whatever, 6 months, 12 months. You're probably going to have to spend all your money. You've got to throw it in there and have the faith that this is going to be awesome and it's going to work and it's going to be great in the long run. You've got to have like an appetite for risk if you want to do a practice. In the long run, if you planned it well, if you've done everything right, then there's a good chance that the risk is fairly low. You'll have a pretty solid practice. There's a lot to do and to get there and a lot to sacrifice to get to that point.
So on this second part of my interview with Dr. Matt Hedge, we talk about how maintaining a healthy work-life balance is essential for long-term success and well-being, prioritizing self-care such as exercise and personal time, and helps prevent burnout and improves overall productivity. We also talk about how Dr. Matt Hedge has discussed the importance of focusing on things you enjoy and delegating tasks to others who love them. We also talk about the importance of ongoing learning and improvement in his aesthetic dentistry skills. So have a listen.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker. So let's talk about that. What are some of the biggest challenges you faced when opening up your practice and how did you overcome it?
Oh man, I guess like early on is that risk of that fear of the unknown, because you're going from something that's so safe. You're used to having X income that you know is going to be there all the time, and you're going to something where people are telling you, hey, look, if you want to do this, you're probably not going to make any money for the first, whatever, 6 months, 12 months, who knows, whatever. You're probably going to have to spend all your money, and you've got to throw it in there and have the faith that, this is going to be awesome and it's going to work and it's going to be great in the long run. So I guess that risk, you've got to have like an appetite for risk, I think, if you want to do a practice. And I think, in the long run, if you planned it well, if you've done everything right, then there's a good chance that the risk is fairly low, that you'll have a pretty solid practice. But there's a lot to do and to get there and a lot to sacrifice to get to that point. So yeah, I think money is big, obviously, for a lot of people, and you've got to go from something that, for most people starting a practice, you've been working for many years for other people, so you've built up money. You're used to having whatever you want, or the nice things, or being able to fly business class or whatever you want to do, and then you're like, hey, you probably should be eating chicken and rice right now. Like I spent all my money on this practice. Like I initially came into it going, sweet, the bank will pay for everything, I'll have this big loan, but it's cool, I'll keep my cash, and spent all my money like that I'd saved for years on, and I have very little money right now. Like, to be honest, I've just thrown all my money into this. And so that's a big risk for a lot of people, probably aren't comfortable to do. And as a single man, like it's, I can do that. But if you've got a family and kids, maybe it's a scary thing for you to not be able to have this nice income to do that. And are you willing to sacrifice? Is your family willing to sacrifice for the long-term gain of having something that could be really, excellent for your career, financially beneficial and whatnot?
Yeah. I mean, so basically, if I don't want to put words into your mouth, but I'm hearing basically there's a lot of planning involved, right? And there's a lot of lead time. You got to start saving up for it, to determine, because it may not be, as you mentioned, the bank's not going to finance all of it, and you're going to have to put additional money out of your own money into it to get the job or the goal that you want achieved.
Yeah.
How do you go about building your team? You mentioned culture a little bit there. So how do you go about building your team, and what kind of qualities do you look for when you hire kind of new people?
Yeah. And oh man, that's a great question, because I think it is probably one of the make or breaks of clinic. If you have a great team who are supportive, who work well together, and they're great, you are blessed, and you're going to have a much smoother time. I think if you don't have a supportive staff, it's really, really hard. I'm really, really, really lucky with the team that have come on board with me at Helix, because like my nurse who I've worked with for years, she's come on board with me, and she's working, she's like practice manager for all things clinical. So she's clinical practice manager. And Sage, who I worked with at Oasis years ago, funnily enough, I did his Invisalign, and he was applying for jobs, and I see he had resumes, and I was like, dude, do you want a job? And he's like, yeah. I was like, all right, cool. So he started, and then I got him a job at Oasis, and he worked there for whatever period of time, but he left. And then he approached me and said, hey, I want a managerial role. And I said, oh, this is awkward. I've already given it to Gabby, but what if I split the role and you do your admin practice manager and she's clinical practice manager? And it was the best thing I ever did. Like, a lot of people would say, oh, you can't do that. You can't afford to pay 2 people this wage and I can't afford to not pay those people that wage. Like, they do so much for me. And he takes all of the HR, he does payroll, he does all the reconciliation and invoices and health fund things that, to be honest, I don't know very much about, and I don't love that stuff. And she runs all things clinical. So she makes sure, like, anything to do with, infection control, steries, staff, equipment, materials, ordering, all of that. So she just manages that. He manages their part. And so the split has been excellent. And had another couple of people just reach out because they saw, what I was doing, and say, hey, look, we're looking for work. And they've been really great. So the team is really, really good. Really good.
Yeah. Because a lot of, we've had people come on in the past, but they've talked about, they actually considered doing an MBA just so they could kind of understand the finance side of things before kind of opening up their own practice. But,
it's really, really, there's a lot to it. And I've said this to a number of people who've reached out to me and said, hey, look, I've seen you just go to your practice. Like, where do I start? And that's it. There is so much to it that you don't know, because majority of us are not businessmen. We don't have a bachelor of business, or we don't even understand like how a business works, or that sort of stuff. I definitely didn't. So I went and did Nove's course and the practice ownership and buying course in Brisbane, and that's my 100%. If you're considering it, you have to do the course. There's no option. You have to do it. I get no kickbacks from that. It's just purely because I went to it. And if I didn't do that, the amount of things that I would have done wrong, or, things that would have cost me, the course pays for itself like 1 billion times over. Like, I got my contacts from that. I got my lawyers from that. I got my accountants from that course, plus numerous other contacts for finance and things like that as well, just from meeting people at that course and going through and kind of understanding some of the concepts of, money in and out from a business and staffing things. And so for whatever it is, a day or 2 days or something, it's an essential one, I think.
Yeah, no, that's fair enough. Because I guess to your point, when I've talked to other people in the past as well, they've also talked about how, you could do it, you're at your own pace. Like, you could spend the time yourself to go and learn all this stuff. But if you're trying to move at a quick pace, do you spend the 10 years it takes to kind of get there? Or do you spend, the 3 years and you borrow someone else's 3 years to kind of help build that picture up? Quicker.
Do you mean as far as learning, what you need to do to run a business? Or?
Yeah.
I think, I don't know, like, about, degrees and things. Like, if you're going to do a business degree, like, I'm sure you learn a lot of concepts, but you'd waste so much time.
That's what I'm saying. Yeah.
You just waste so much time learning non-relevant things when there's such a specific niche industry and dentistry that you need to learn about. And I just don't think you can learn that just by Googling stuff or by going to a generic thing. I think you need dental specific people and I'm pretty big on that like all of my team, as far as like accountants and lawyers and all the people, are very dental specific. They've got a lot of, dental history and knowledge. So, a regular accountant just might not understand the intricacies of how different levels of trusts work for a dental practice or something like that. And, so I think you have to just take advice from the professionals. And I was guided, I definitely took a big blind leap of faith to do the practice because I did it quick. I think I did it very, it moved very fast, we got it going. But I was, after doing Nove's course, I had the people that I needed, who I was like, okay, if you trust these people and I trust you, I trust them, and they, they're good, sweet, let's do it. So I'd be like, what do I need to do? Tell me, what my next step is from here. And I would follow the leaders, basically, and this guidance of this team or network of, lawyers, accountants, financial advisors, people from banks, Nove himself, and a lot of people that helped me out along the way, because it's an absolute, it's mind-boggling how much there is to do. And you end up with this list and you're like, this is astronomical. Like, how am I going to get through this? And you do, but it's a lot. And without those people to ask the questions, I don't know if I would have been able to do it. So yeah.
So I mean, you're in your early days, and one of the hardest things is about marketing your practice and attracting new patients. So do you have any tips on that? Or
I think it's a big topic that we could talk for so long on, and something that I'm quite passionate about, because, to be honest, a lot of my career, a lot of my work has come from social media, which is crazy, because it's free except for your time. Your resource you're paying is time to do it, but it's done heaps for me. And I think the combination of having good word of mouth is, you're never going to be able to replace that. That's awesome, and that needs to be there. But showing people your practice and that you're proud of it and what you can do is just awesome. And that comes back to taking photos. If you don't take photos, you got nothing to show people. And as soon as I started taking photos, then people were booking in saying, hey, I want that thing that I saw on your Instagram page. And the more you do that, the more you build it up. And so for us, like, at the moment, I'm running the Instagram page myself, which hurts my brain, and I'm really trying to outsource it at the moment, but I'm also very particular. So it's really hard to let go of. But posting those things every time I post, like, you're getting rewarded for it. You always get someone who comes in and says, oh, I saw that post, I want to do this, or replies to a story and says, hey, I forgot to, I've been meaning to message you, I saw your story and I messaged you. It just always works, but it's always hard in the start, because you've got a small audience, you don't have much to engage with, and you feel like it's worthless. But it's a long game that you've just got to chip away at. So, but I think that's where it comes to networking, and being involved in your community as well. Like, if you're someone who never goes and talks to anybody or goes to anything, doesn't do any social stuff ever, then you're going to find it a lot harder to get that word of mouth and get that social credibility when you don't have any kind of support or followers. But once you kind of build that up and you go out and you talk to people and you meet people, you might sponsor some events, you might help out at the local football club or volunteer your time for this, and people go, what do you do? And you go, I've got a practice down the road. And then next thing, you've got this family and their kids, and they'll refer somebody else. It just builds on top of each other. But I think a lot of that comes down to being able to connect with people and talk to people and build that up, because social media is you're not gonna have thousands of followers overnight. You've got to build that up, and it starts with the people in your immediate circle, the friends, your family, your friends of friends, your parents' friends. This growing network that you need to build actively, and you can't just sit back. I think people go, oh, Instagram doesn't work. I'm like, it doesn't work if you don't work for it. Like, you're not going to put a post up and just sit back and be like, all right, where's my money? Like, you've got to, be consistent, and you've got to persevere, and you've got to engage, and you've got to talk to people. So I think it's not easy to do. And I think it's hard to, it's hard to get into. It needs a course on itself. It needs a social media marketing course to go into that, I think, because it's a hard one to do, because you've got to have, you've got to have a lot of skill sets built up to that. Is your photography good? Is your actual treatment good? Are you like comfortable behind the camera? Are you comfortable asking patients, can I put your photos on my Instagram page? Is that okay with you? There's a lot of things that you've got to be able to, tick off to get along before you can just, put it all up. So it's not easy.
So, I mean, so that comes to the question, how do you balance work life?
Sure. Not great at the moment. No, actually, no, it's much better than I thought it would be. I think my work-life balance is pretty good. And I've learned from burning out a couple of times throughout my career, even in my first year, just, burnt myself right out. But yeah, I think now some of the things that I think for me, like any kind of exercise is like a no-brainer for me. Like whether for me, it's mostly gym because of the flexibility. I love it anyway, but the flexibility that I can go at 8 o'clock at night or 5 o'clock in the morning, there's no excuse. It doesn't matter if the weather's good or bad. You can go to the gym and you can do a session, whether it be a little session or a big session. You can do some kind of activity. I think that mentally, it more than physically is like essential. Or whether it just be it doesn't have to be gym related. It can be a social sport, or it could be yoga, or it could be boxing, or it could be just going for a walk or a run. But I think physical activity is, if I didn't train, I would definitely not feel as leveled as I do. So I also kind of try and structure in times for doing nothing. Like my weekends, I will try and people are like, what are you doing tomorrow? Do you want to do this and this? And I'll say no, because I've booked in basically me to have time with me and just do nothing. It's often for me, like my me time is, there's a little cafe across the road, there's a little surf club at the beach, and I go across there and I read my books because I like books. So I'll go across and I'll sit there for 2 hours and drink my coffee and read my book. That's my me time, and that's me switching off from people and things and all stuff and just reading. So I think it's easy to be like, I'm too busy, I don't have time to read books, I don't have time to go to the gym. But I think personally is that you can't afford to not do that sort of stuff. Like you've got to book it in, just like you would book in going to your doctor. You've got to book it in, like they say, okay, Wednesdays and Fridays, I'm going to go do yoga. It's a non-negotiable. I will be there. I will do that, regardless if I'm tired or if I had a shit day at work or whatever. Those things for me are like the non-negotiables that I think for a long career, if you want to be healthy mentally and physically, it's just essential to do. So, and I don't think time's a good excuse, because if you work yourself out, what good are you going to be if you're burnt out or you're less efficient because you're too tired? So I think anyone should try, and it's easy to say when I don't have a family and kids, because I know that makes it difficult, but even just to fit in a 30-minute something somewhere for someone would make a big difference, or finding an activity that can involve the kids, or you can take them or go for a walk or something like that. So yeah, that's kind of my balance, as far as how I keep things level. And I make
just got to book it in, and don't make an excuse for it.
Appointment for yourself.
Yeah,
it's something that I think a lot of people forget about, and then it takes you to burnout before you realize that, hey, crap, I actually haven't been taking care of myself, and I've cut all these things that I enjoy doing out of my life because I'm too busy with work or I'm too tired. And I think we're all guilty of it. Like, I'll be like, man, I couldn't be bothered to go like to this person's dinner. I'm just like so tired after a big day, or I've had a crap day. Sometimes you just gotta make yourself go, and you always have fun. So
Yeah. So then what would you say your ideal week might look like?
because it's a new practice, it's a little bit different than normal, but it's surprisingly been really busy, which is wonderful. But a normal day in general for me would probably be, there'd usually be a couple of cosmetic or Invisalign consults in there. So I do spend a lot of my day talking, fine, because I liked it. I like chatting to people, so it's cool. Usually there'll be like, maybe like an Invisalign fit, a couple of new patients or existing patient cleans and things like that. Because I don't have a OHT or a hygienist at this point. So, and I didn't at Oasis either. So I'm used to doing all my own cleans. Going forward, I'd like to put on an OHT for that, but I'm fine with it for now. And quite often, I would say like probably like three days out of 5, I might be doing some form of cosmetic work as well in there. Like, and they're usually big appointments, so they'll take up like half the day usually. Like if I'm doing a bonding or a veneer preps or whatever, anything like that, that'll be like either a full morning or a full afternoon. So that takes up a good chunk of the week there as well. Same with like Invisalign finishes, debanding everything, putting the wires on, doing all the polishing, doing a little bit of Invisalign, post Invisalign bonding, that sort of stuff. So they're usually bigger appointments. And that was what I was, when I was at Oasis, when I was, in a consistent, steady flow, that was what a normal week would look like. There'd be, a number of bigger, longer appointments and some more scattered consults and checkups and cleans and new patients and things. A little bit of fillings. I've done 2 root canals in the past few years, and both of them were in the past month at the new practice. And that's probably it. I'll probably leave it at that. So yeah, I really kind of niched down in the past few years, just did a little bit less of the other things and a little bit more of what I liked. And when I was at Oasis, we had other people that were good at root canal or extractions and things. So why not let them do the stuff that they love? Because I don't love that stuff, and I'll do the stuff that they love. So that we had a good thing like that, and so that's cool. So that's what I'm like, rebuilding back at Helix now, where I've got guys that are going to come in for the wisdom teeth or surgery implants and things, and going forward root canals and things like that. And so I can just focus on doing the stuff that I enjoy and that I'm good at, because at the end of the day, you can either be all right at a lot of things, but I'd prefer to just do the stuff that I really focus on and that I enjoy. So stick in my lane, I think.
And I mean, whilst we're on this, what would you say success looks like for you yourself in the future?
I think it's different both for me and for the business. So I think personally for me, like I'm always going to be chipping it away at improving, for my aesthetic stuff. Like I don't think there'll ever be a point where I'll be content or like satisfied with like being like, okay, this is it, I'm good now. Like I can stop learning, or I can stop trying to be better. Everything I do, I still look at it and I'm like, oh, I could do this better, I could do that better. And so I think it'll be an ongoing just refining skills with my aesthetic stuff. Like ceramics, I think there's a lot of skill involved in in preparing and stuff, but a lot of that skill comes back to your lab and your technician as well. Whereas composite, there's no hiding. There's just no hiding. It's all you from start to finish. You're 100% in control of the outcome, and that's why it's so hard. And also that's why I enjoy it, because you've got to hit every step yourself. And so I think that I've got so much that I can improve and learn in my composites, and to get them to a really, really excellent standard, And so I'll just keep chipping away at that over the coming years, keep working on that, improving more knowledge and whatnot with Invisalign. And as a business, I kind of want to put a lot of training and effort into my team. So like I want the associates to be like the superstars of the clinic. Like I don't really want the clinic to be about me. I don't want to be like, hey, this is Matt Hedge's clinic and his team. Like I want them to be the superstars. And I would love to just do my thing in the background and watch them all grow and be excellent and be better than me. So I guess I don't have any fear of like my associates. You hear of some people that like, their bosses are like, concerned that they'll outgrow them and but realistically, I love teaching and I love training people and I love seeing people grow, because it's like you get to live vicariously through that and it's super fun to watch them like learn. So I'm very excited to like grow this team of people who are like super skilled and super talented and just kicking goals. And then I would love to, pull back and not do as much hands-on. It's still work a few days a week, but I would love to, spend a lot of my time growing the team and the people and making the business work really well. So we'll see how it plays out over the coming years.
Yeah. I mean, didn't at one point you have like you're in bodybuilding at one point, weren't you?
Yeah.
Yeah. Weren't you thinking about going to like international at some point?
Yeah. Well, that was like an interesting like point where I did a few shows, and then it was kind of like, I'm just, the goal was just to do a bodybuilding show and win a bodybuilding show. That was the goal. That was the plan. And then I went in and I did it and I won. And then they're like, oh, cool, now you're on to the next level. And I was like, what? There's a next level? Oh, damn, when's this next level? What do I got to do? And they're like, oh, it's in 5 months. And I was like, fuck. So I've got to do this all again. And I had to do it again. Well, I didn't have to, but, like I'm here now. I may as well like keep going. And so then I went in that and won that. And then, so that was pretty crazy. And then, so that took me to like the next level where I got like a professional level and got a pro card for it. And so then I had to compete again, and it just kind of, it just kept going. So I got to the point like of doing that where it's like, wow, I've got to make a decision here. I can't like balance doing both of these things at 100%. I don't have 200% to give. And yeah, bodybuilding is fun and I love it and I love training, but it's not my career and it's not my like what I want to do with my life. So, I did what I did and I loved it and it was really fun. But at this stage, I'm not competing anymore. I'm still doing like a lot of training and I'm starting some programming next week, but it with no like desire to jump back on stage anytime soon, because I'm just very focused on Helix at the moment and growing the practice and working on everything else. So
yeah, for our listeners, I mean, you can't enjoy the luxury of seeing Dr. Matt bulging out of his shirts, but for our viewers that are watching, you'll get to enjoy it all. I mean, I love the fact that you're talking about this mentoring and building, because do you do some sort of teaching and mentoring at boxings and girls boxing at some point?
Yeah. So I've done a fair bit of like coaching and things. I don't know. I just enjoy, like I said, I enjoy training. I enjoy teaching people. And so when I moved to the Gold Coast, and before that I was coaching football. So even during uni, I was coaching junior rugby sides. And then afterwards I've been helped coach a few rugby league sides. And then I was doing helping out with some coaching of like a girls, like kind of like a girls empowerment boxing sort of thing for teenage girls to kind of like, just improve their like self-value and discipline and all that sort of stuff. So it was really cool. So
yeah. Do you see a reoccurring theme here of the people that you're training? Yeah. I'm talking about like a lot of them might come in, not where they want to be. But when you're trying to train them, do you see that there might be pushback or stuff like that along the way? And then it's just about reframing the mindset. I don't know. I'm just putting words in your mouth now.
No, big time. I think like everyone who's being, trained or coming to learn has got some kind of, they've got something that they've got to kind of step over, some hurdle to overcome to get to their destination, really. And so always, I mean, when it's like kids in footballs, it's like, they've got all these attitudes and they've got what they want to do and what they want to think, and it's always a lot of fun trying to deal with their crazy personalities, which is good fun. But and the girls come in with a lot of like, the girls, some of them would come in with like self-esteem issues, or they've got like family problems, or they've got a combination of different things going on. But I think when you've got a goal like that, whether it be boxing, or whether it be like a career-based goal or a specific learning goal, it's a really good like thing to give you some kind of direction and to kind of overcome personal stuff as well. So I think having that direction and not like having that focus on the negative or the problems that have people, that makes a big difference for people just driving forward. And I don't think it matters what you're learning or what you're doing, as long as you're passionate about it and you enjoy it, and then it makes a big difference.
This passion to teach, your enjoyment in seeing other people grow, do you think it stems from somewhere? Because I can really hear the passion in your voice when you talk about it, and when you talk.
I don't know. I mean, I guess I had some pretty great like mentors and things growing up from like from as like a kid, as far as like even like martial arts and kickboxing and things like that I did. I had some really great mentors that were really good instructors and really good teachers in general from there, that I think I learned a lot about like what it takes to achieve something, anything, whatever like your goal. And so I think they instilled a lot of like hard work from an early age, and not just assuming that like the world's going to give you what you want. You've got to like go out and really drive for it and hustle. So I think if you're taught by great people, it also helps to teach you to become a great teacher as well.
Right. Well, I mean, that's a great lead up to the next question, which is, do you have any wise words for the budding young dentist? And, what do you think are some of the key skills and attributes that they should, focus on developing?
Yeah, for sure. I think, as we were mentioning before, I think taking care of like your physical and mental health is so important for like young new grads and everyone really. But I think particularly when you come out of uni and you're like, I've got to commit all my time and energy into work and nothing else, and people cut all that other stuff out, and they kind of they don't benefit themselves by like not looking after themselves, and then burning out, then you're not your best for your patients. You're not going to learn well, you're not going to perform well. So I think as we went through before, I think that's huge. Take care of yourself. I think invest in yourself early, which is probably something that I didn't do as much or early on in my career, because I think with finding good CPD, if you can make a solid CPD plan, if you can have a structure to it, and you're saying, okay, in this year, this is my budget for CPD, I'm going to do these courses and I'm going to prioritize them because this is the most important that I need right now. And going forward, having that plan where you structure your training and you structure your budget for your training, I think makes a big difference, because the earlier on that you can attain these skills, the better your return on investment. And I don't think there's a better return on investment that you can get than on your education, like on your CPD, on your training. Like you can put money in stocks, you can save up for a house, but I don't think there's any that will be as good as having, investing in yourself, both from a financial standpoint, but also from, just an enjoyment standpoint and feeling good about yourself and your job and being happy. If you're a good dentist, you're efficient, you have minimal, problems, then your life's going to be much better. So I think investing in yourself is probably one of the biggest ones. Networking, I think, it's really easy as a dentist to like get like isolated and just be kind of, keep to yourself and whatnot. But I think, every time you create a network or you meet a new person through dentistry or outside of dentistry, it opens up so many doors and so many avenues, and so many of my life opportunities have come just from random things, random friendships, random people I've met somewhere, and they've come across a thing. Like I had coffee yesterday with one of my childhood friend's brothers, and he's a PR agent, and I think it was last year or the year before, he was doing PR with Extra Sugar-Free Gum, and they were looking for a dentist to work with. And he's like, I know a guy. And, I'd met him a couple of times and we'd chatted and stuff, but nothing too crazy. It was just that my other friend's friend, and I'd met him. And so, yeah, I got offered that gig straight away. And it was just a matter of just knowing the right people. So like, they're always like, it's not what you know, it's who you know. And it's so true. Like the more people that you know, and the more people that you've, made friends with, I think it just opens up a lot of opportunity, like long term for, whether as a person, as a dentist, or as a business owner, it makes a big difference. I think the last point would be, like, we talk and we go through so much detail and so many specifics of things, but like, I think sometimes we just forget to kind of enjoy the whole process, like step back a little bit and be like, hey, this is our job, and we're doing so hard, like we're doing so much to like be the best at our job, but like, don't forget to actually enjoy it, because, through the progress of it, you can stress yourself out the whole way, but don't forget there's good parts of it. And it's like, it can be really fun. It can be really rewarding. And we're really lucky to have a job that is, that is so good, and, allows us to live the lifestyles that we like, work the hours that we like, do the treatments that we like, and help people. So I think stepping back sometimes and just being like, hey, this is pretty cool. Like, I've got a pretty cool job. I'm pretty lucky, and just being a little bit grateful for that, I think, is something to keep in mind.
And when you were talking about the sugar-free gum thing, I was actually going to ask you about, that's where I heard you give really good dental dating advice. Something about, bad breath, the Aussie romance killer.
Oh my God. That was funny. Yeah. I can't remember it, but yeah, it was all a bit of fun. Hey, it was a cool experience. It was really fun. It was the first time that I'd done like a lot of speaking on camera. So I was super nervous. And like, not only having to speak on camera, but having to like talk and move in things, and they'd be like, do this, add a bit more pizzazz to it. And I'm like, dude. And this is
dancing at that point.
This is me at the end of the day at work too. Like this is like, I've just finished a full day at work, and then the camera crew comes and we film to like 9 o'clock, 10 o'clock at night or something as well. So it wasn't like, it was pretty hard, but it was really cool. It was really fun. And I think it was just cool to practice, like, being on camera, being able to talk, because I had to do not only like the filming stuff, but I had to do a couple of radio interviews, and I had to do it was COVID at the time. So I think it was like Sunrise or the morning show or something. And I had to do like an interview like this over. And so that was super nerve-wracking, because I was like, oh my gosh, I'm going to be on TV and I could totally screw this up. So it was fun. It was cool. Just a cool experience. I'm so down for that sort of stuff. And you're like, hey, that's kind of cool. That's fun. Like, not every day you get an opportunity to do something out of the ordinary like it. So it was cool.
Yeah. So, I mean, Dr. Matt Hedge, there's so many more questions I want to ask you, but I want to thank you for coming on today. If you could let the people know how they can find you, or,
Yeah, awesome. Instagram, you can find me on Dr.Matt Hedge, or the practice is Helix Dental GC. Facebook, if people want to reach out, shoot me a message. I'm on there as well. Happy to chat or take questions if people have specifics about things, or practice ownership, where I can help and where I can guide people into to the people that, can give them, the advice that they need. Feel free to shoot out and reach me a message. But thank you so much for your time. Thanks for having me on. It's a lot of fun.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.